Thank you. I'm Dr. Stephen Nelson. I'm a forensic pathologist and a neuropathologist, and I head up the State Medical Examiners Commission. Florida has 67 counties. The Medical Examiners Commission, which has oversight for how medical legal death investigation is conducted in the state, was established in 1970 and became law in 1971. Prior to that, Florida had a Justice of the Peace coroner system. That did not work for a one single celebrated case that caused a lot of the medical examiners, coroners in the state to leave. The system establishes the Medical Examiners Commission, which is the users of the system. Ken Jones, to my left, is the state registrar for vital statistics. He represents the state Secretary of Health. We have a representative from the Attorney General. We have elected public defender, an elected state attorney. We have a sheriff. We have funeral directors. Those are the people that use the system. They're the ones that, we also have a county commissioner. The counties pay for the system. So those are who is represented on the Medical Examiners Commission. The way Florida has historically counted deaths has evolved over time. I've been in the state since the late 80s. We had Hurricane Andrew in 1992. For Hurricane Andrew, you may remember there were a number of press reports that there was a large barge off the coast of Miami where all the deaths were being sent so that they would not be counted. Complete fake news. Subsequent to that, the Medical Examiners Commission established a counting reporting system. It now comes into play when the governor issues an executive order. Yesterday, our governor issued an executive order for 25 of our 67 counties that will be in the projected path of Hurricane Dorian. So those 25 counties now, since yesterday when the executive order was filed, are now counting deaths that occur either pre-storm. They will count deaths that occurred during the storm, and they will also count deaths that occur after the storm. So both the pre-impact, the direct result from the storm itself, as well as post-impact fatalities. So that's how we now move forward with that. We have no time frame at the end point as to when we stop counting. In forensic pathology, the term is proximity, what started the ball rolling. So if what started the ball rolling was something related to the storm, we will count it regardless of how long ago it was. We're still counting deaths that occurred from Hurricane Michael. And aside from Hurricane Michael, that was an important learning tool is, and again, the parable, don't put all your eggs in one basket. Up in the Panhandle, the county governments used one cell phone carrier. That cell phone carrier was wiped out with Hurricane Michael. The only way that we had access to the medical examiner there was because it was a relatively new medical examiner who had relocated there from South Florida. He had a different cell phone carrier. So because he had that different cell phone carrier, we were able to access him. So moving forward, you know, it's probably a bad idea if you put everything into one basket. But I'll be happy to answer any questions later on how we count deaths. But that's essentially it in a nutshell.